it became harder and harder, first with my right hand and then with my left, to do simple tasks. I would say over the course of a year, it got to a point where I realized that this was out of control. And my neurologist in Tucson said, you need to call Barrow. They have this procedure, and my life changed.
The experience with essential tremor for people, it's insidious, right? Things don't all of a sudden one day you wake up and you're disabled. Essential tremor is something that people can develop in high school, and they learn to live with it. Their primary care doctor manages it. There's a couple medications that are known to work. Eventually, at some point, they kind of realize that it's getting in the way to a degree, or people encourage them to get it evaluated, that they start looking into it, and it may be decades.
My right hand had progressed to the point I could not button a shirt. By then, my left hand was deteriorating. With two hands, I couldn't eat food with a fork or a spoon. And when they pulled me out of the MRI and Dr. Ponce said, well, we've got it, and I was able to hold my hand out, and she started crying like a baby because she had lived with it and seen it get worse and worse, progressively worse.
Having treated now over 100 patients, I think that one of the experiences I see is their response afterwards. And I haven't seen more patients break into happy tears, spouses, grown men crying. I mean, it's almost like every month I have a couple patients that break into tears when they see coming off the MRI table that they're not shaking.
Dr. Ponce said, well, we need to talk about the second side, because you could see that my left hand was really bad. I couldn't wait for the opportunity to do the second side, quickly enough.
On treatment day, when patients come to the Barrow for focused ultrasound, they show up shaking, and an hour and a half later, they're leaving without the shakes. We have a therapeutic helmet that's like a dome, and there are over 1,000 sources of ultrasound energy. And each of these sources of ultrasound energy by itself basically is useless. It doesn't do anything. So any tissue that ultrasound energy goes through, nothing's happening. It's not until you get to where that focus is for those 1,000 sources that we can actually accomplish the goal of increasing the temperature in a very controlled manner.
I'll be placed in an MRI machine with a metal frame to hold my head rigid in the machine.
There's 4 points of fixation, and basically it's just through pressure at 4 points. We inject the local anesthetic to numb the areas of the scalp so that it's less uncomfortable putting this frame on. And then we put this like watertight band around their head. It's kind of like a tight headband. And that's because during the procedure, their scalp is bathed in water that's pretty cold. It's 57 degrees Fahrenheit. And it actually helps to numb the scalp as well as control some of the heating that can occur as the ultrasound energy is traversing the skull.
In these first two, I heat the tissue up to 41 degrees Celsius, then 48 degrees Celsius. Both of those don't really do anything to the functionality of the nerves. So I'm just checking to see where it's heating.
It's how we verify that spot of the brain is the correct spot.
Then after the low intensity sound waves, the high intensity sound waves are applied, and they ablate the portion of the thalamus where the tremor originates.
It's like creating a very small stroke, but in a very safe and therapeutic way.
He started applying the treatment, and my hand just went like that. I couldn't believe it. It was the most miraculous thing. I mean, I literally was tremoring, and during the treatment, I was able to watch my hand and watch it just steady out. When they pulled me out of the MRI, I was laughing, I was clapping my hands. That was it. A miracle.
How'd it go? How are you feeling? How was it? Feeling great. Okay.
Once we do that, then we're done with the tremor is gone.
Look at that. Look at that. That last treatment, I could feel it just disappearing.
These therapies like focused ultrasound are very safe. They're effective. They're covered by insurance. They've been proven through rigorous medical trials, and these are accessible treatment options for patients in Arizona.
I feel like I've regained my old self.
As a brain surgeon, there's life-saving surgery and there's life-changing surgery. And my subspecialty is life-changing surgery. I change people's lives. I give them their lives back.